or being healthy is no more a fad or a trend, it has become a lifestyle now. Today we have Dr. Arun Warrior in our show. Welcome to the show, Doctor. He is a consulting medical oncologist in Aster Medicity, Cochin. Well, Doctor, it's a pleasure to have you here in the show to answer a few questions that our audience have and we have for them. So let's talk about cancer. What is exactly cancer?
See, cancer is any abnormal growth of cells is cancer. So what happens in cancer is that the cells in our body grow. If you ask me, that is the basic reason for cancer. So in cancer, the only thing is that all the cells grow in our body. But in cancer, these cells have the ability to go to other sites also. Okay. So they form a mass. Maybe if you take the most common thing is a mass in the breast, which is the most common cancer. It forms a mass in the breast and it can also go to other areas like lungs, bones, liver. It can spread wherever. So it has got this potential of growing, limitless growth is there. And slowly the normal cells are destroyed because of this growth. So that's what happens in cancer.
So that was about what is cancer. Now we understand that there are a lot of types, many types of cancers. I think in fact now it has become countless also. So can you just take us through some of these so that we are aware of the commonly found ones?
Definitely yes, because you asked me about cancers, what are the common cancers. In females, the most common is cancer in the breast. That is the most common cancer. And if you take the case of males, it is a cancer in the head and neck and the lungs. These two are the most common cancers. And one question which people have is that, is it becoming an epidemic now? Not really, because we tell about the incidence or the numbers of cancer in per lakh population. If you take Kerala, it is around 100 per lakh. So that is the approximate number of cancer patients. If you take 1 lakh people, around 100 can have cancer. If you take very developed Western countries, it comes around 400 to 500.
Oh,
and
okay. So at least the ratio is less here.
Yeah, it's less here, but it is growing. And I think the main reason for that is not that the numbers are actually growing, but we are able to diagnose cancers more. Because there are a lot of investigations and a lot of hospitals are there where we can do tests and we can take biopsies and diagnose
So it is
cancer.
actually not diagnosed till the time they don't show some symptoms.
Yeah, that's that's the most important problem with cancer, because unless it comes up like a mass, we cannot diagnose it. Suppose a normal man comes to me and asks whether I have got cancer, I don't have an answer for that, because there are no screening tests available for a normal individual which can definitely tell that he doesn't have or he has got cancer. Yes. It has to present like a lump somewhere. So the most common symptom for a cancer is a lump. It can be bleeding. It can be bleeding through the cough. It can be bleeding in the stools, or it can be an abdominal bleeding anywhere. Or it can be an ulcer which does not heal. So these are the common symptoms which the cancer patient presents with.
I don't think this question now comes to anyone in this century, but I would like to ask you again, is it contagious? Will it spread to others?
Definitely not, because as I told before, cancer is an abnormality which occurs in our own cells. So our cells are growing, that's all. We are not getting it like an infection from someone else. In the same way, we cannot pass it on to others also. So I think it's very important, because many times people are isolated because they have got a diagnosis of cancer. I think as doctors, we also have a role in that, because when someone is diagnosed with cancer and when they are getting treatment, maybe chemotherapy, we tell them not to go to others. So the main idea is that they should not get infection. It is not that the cancer will spread to others. We want them to contain, because they are isolated, because their immunity goes down with treatment. So in that situation, they should not get from others. There is no other reason why we are isolating them. It's not because they can spread it to others. So particularly,
I think instead you need to create the positive environment for them.
Yeah, definitely.
So
they have to interact with others. They should maintain their physical and mental health. Otherwise, the treatment may not be fully effective. So that's very important. Yes. Yeah. We also promote them to go out and to go on with the routine activities. And that means it's too early to talk about treatment per se, but still the cancer treatment has become so easy now, so that we are able to, even chemotherapies can be given on a SOP basis. It's hardly a few hours where we can give chemo and they may go back to their home. They can go back to their work. They can go back to all activities can be continued. We actually promote them to do that, so that this positive feeling is maintained.
So we have questions from the audience side as well. We have a couple of them. The first question goes like this.
Hi, my name is Vivek. I am from Erapalli, and my question is, how can one prevent cancer?
I think that should be the most important question, because as I told before, once it comes, then things may be difficult.
Yes.
Yeah, because
the only way is to prevent it.
I think that one was the most important things which you have to do, particularly for the youth. So the main aspect, because we really don't know what causes cancer. It is not a single thing which causes cancer. It is not like an infection which leads to a cancer. Okay, there can be various factors can be there. So we can try to prevent, which are things we can do. I think that should be the main thing. So the first thing is tobacco. If you ask me, that's the most important thing which we should prevent. Use has to come down if you really want to prevent cancer. Tobacco is a culprit for most of the head and neck cancers, which happens in the mouth. Most of the lung cancers, stomach cancers, if you ask me, that is the number one reason is tobacco use. And nowadays in the youth, the use of pan masala, gutka, all these things are increasing. So that is actually more dangerous than cigarette smoking. Because cigarette, people may know, people may see that someone is smoking cigarettes, so they may tell them, you should not use and all, particularly in the teenage, when they are going to schools and all. But the problem with this pan masala gutka is that it all remains inside the mouth. So there is a constant contact is there with the harmful chemicals and our body. Because of that, the cells change very fast. In couple of years, we have seen patients who come with very advanced cancers in the mouth. Okay. Because tobacco smoking may lead at least maybe 10-15 years they have to smoke for the cancer to come. So in that time, there is a time period where we can counsel them and we can stop them. But for this oral cavity, these harmful chemicals, particularly gutka and all, they are very dangerous chemicals. So direct contact with the skin. So the cancer comes very quickly. So I think that's the first thing. Tobacco products, it may be in the form of gutka, pan masala, in the form of cigarette, BD, whichever form, this has to be completely stopped. Then we will be able to prevent a large amount of cancers can be prevented.
So is it also hereditary?
The heredity is one of the reasons. Because why the cells change? It's all a problem in the DNA. Why somebody changes, why someone else doesn't change. So that is just one of the reasons for that. So the DNA change is actually accelerated by the use of harmful chemicals. One is tobacco. The second will be to have a healthy lifestyle. Because once the lifestyle becomes unhealthy, once the exercise is less and once you start consuming more fatty food, then this again the oxidation occurs more and the harmful chemicals are found more inside the body. So it will again lead to cancers. It is particularly important in cancers of the colon, the gastrointestinal tract and all, where it has been shown that fatty diet and the diet which is very high in non-vegetarian food, that can lead to the people who consume such diet are more prone for colon cancers. So it is important in GI cancers, gastrointestinal, stomach cancers and also endometrial cancers. Diet plays a very important role.
Doctor, this is the next question.
I am Ajin Wimbal. I am 26 years old, coming from Alleppey. I have a question. Can cancer come in younger age?
Cancer can come. Even newborn kids can come with a cancer because it's a problem in the DNA. So there are kids who are born with a cancer, particularly liver, kidney and all. So right from birth up to any age, cancer can come. But cancer is more common in the 60s. Actually, the majority of patients, or 70% of all cancer patients, are in the 60s. But it is there usually in the young age, like up to first and second decade of life. It is the blood cancers which are very common, and later the testicular cancers come. So testicular cancers are the most common. Comes in the testis in males it is the most common in the second decade, and lymphomas also can come in the young age. So here the issue is that it comes suddenly. So there is no warning signs. Like cancers comes in the mouth and all, there may be a slow period will be there, where there will be some color change, bleeding, then cancer comes. But in young age, usually it comes very fast, quickly. Like blood cancers and all, it can suddenly come with a fever and bleeding. They may be perfectly normal 1 week back, but suddenly they come with fever and bleeding. So it comes very quickly. So the index of suspicion has to be high, particularly if they're very young. That's one important thing. Yeah.
Doctor, this is the next question.
Hi, my name is Chelsea. I'm from US. I'd like to know, is cancer hereditary?
There are some cancers for which we have screening test. So that applies to cancers which are slow growing, which comes in the maybe 40s and 50s. So the most important is breast cancer, for which we have a mammogram is there, which has to be done once in every 2 years from 50 to 75 years. That's a recommendation for a mammogram. So for breast cancer, we have mammography is there. And for cervical cancer, which comes in the uterus, pap smears has to be done, maybe from the 30 years of age, once in every 3 years, if there is no bleeding, can still be done. And again for the colon cancers in the gastrointestinal tract, colonoscopy at the age of 50, and at regular intervals thereafter will help to
Then you have brain cancer also, right? What do you call that?
Brain cancer. Yeah, brain cancers, there is no screening per se. So, in females, we have breast and cervix, that's a screening. In males, we have colon cancer, for which there's a screening. And prostate cancer also, there are PSA tests is there to, which can tell that there is a chance for cancer. But predominantly for majority of the cancers, because they come quite fast and the growth is quite quickly, so there is no single test which can diagnose cancer. Many of the labs are promoting many blood tests like CEA, CA125, CA90, many blood tests are there which comes in a panel to do, for cancer diagnosis, which may not be completely true from a screening point of view. They are all helpful for a diagnosed patient to know the response to treatment and to know whether the cancer is coming back. But particularly for someone, for a normal person, to diagnose cancer with a blood test is really not possible.
I am Jyotish Kumar. I am from Alapi. I have a doubt, can we cure cancer?
As I told before, cancer, if you have suspicion, that is any lump, any bleeding, or maybe just a fever or weight loss, then you have to consult a doctor, maybe a physician, who will do all the initial test. From that, he will be able to tell whether how we should approach the further test and all. So next should be a CT scan or endoscopy, depending on the symptoms. And if there are any lumps, that has to be biopsy. That is again one more important thing in cancer. We cannot diagnose cancer based on scans and all. If there is a lump, we have to take it out, to take a small bit of the lump, and then it has to be examined under a microscope, and we have to see what are the abnormal cells. So once we have done a biopsy, then we examine it under a microscope and see what type of abnormal cells are there. And then we look which are the areas which are involved by the tumor, like we do a scan and whether it has spread to other areas. And if it has not spread anywhere else, then for most of the tumors, then the initial thing will be to do a surgery and to take it out. And after that, depending on the risk, then we do a risk stratification and then decide whether further chemotherapy, radiation are required. So it's a team approach. It's a multidisciplinary team which includes the pathologist, radiologist, medical, surgical, oncologist, radiation oncologist, all will sit together and decide how best to give treatment to the patient.
I know that we come to know about the cancer only in the later stage, but if you can just tell us more about the stages of cancer, we can have a better idea.
It's not really correct to tell that we diagnose cancer only in the late stages. The one thing is that people are ignorant about it. That is one reason. And other thing is that people tend to think that they don't have cancer. That's also very common. That's why we are more giving importance to the early diagnosis, so that even if there is a symptom, because a lady who is 45 to 50 years, if she develops a lump in the breast, she is well aware that it may be a cancer. But people tend to ignore it. They tend to think that it's not a cancer. So that feeling should go. So they should think that it's cancer. Why people have this feeling is that they think there is no cure for cancer. It's not correct.
So doctor, my question also will be like, if you have blood cancer or something, will you have a lump as a
no. In blood cancer,
symptom?
no. In blood cancer, there won't be any lumps because it's a problem in the blood cells. So the abnormal cells will grow and the normal cells will come down. So they
in
may not
that
have
case,
any
what
symptom.
will be the?
They can come with just fever or bleeding. So blood cancer, that's why it comes very fast and there are no screening tests for blood cancer. And coming back to the staging of cancers, so early stage cancers, if you see the West, in US and all, 80% of cancers are diagnosed at an early stage. Oh. So yeah, so that's the reason why most of them live for maybe 5 to 10 years. Long-term survivors are there. But in our country, it's the reverse. Only 30% or 40% are diagnosed in an early stage. So that's why we are not able to cure.
So then I think we compensate the ratio, right? Even if they have 300 per lakh, I think we are at a loss because
we are at a loss because we are not able to diagnose them at early. And now, particularly in Kerala, there is no dearth for facilities. We have hospitals. There are maybe even in state like Kerala, we have maybe 25 to 30 cancer centers are there where all the facilities are available. But people don't go because of this stigma of cancer is there. They tend to neglect. Even doctors like physicians and all, they may not refer initially. So because of all these things, it get delayed. And in cancer, even a period of few weeks to months can make a difference. It can spread quickly also. So our main thing should be to the index of suspicion should be high, and people should not fear about diagnosis of cancer also. Then they will come early to the centers, and we will be able to cure them. That's all.
At least we can see on TV and all that people start donating their hair and all to cancer patients. So do you think we should really encourage that?
Yeah, I think that's one good idea, because if you ask me, to wear wigs in India is very difficult. That's what our patients tell us, because our temperature and humidity is high. People cannot really wear wigs in the community. But again, it gives a feeling of oneness, that we are there for the cancer patients. Okay, that feeling is there, and it also helps to take away the fear of cancer. So that's why we are promoting these awareness campaigns. I'm not really sure whether that hair will give any real quality of life difference to the patient, but definitely it spreads the word that cancer is treatable. We are there with you during the cancer treatment. Maybe for that, all these
That
campaigns
isolation part can be
isolation part, and there will be acceptance also will be there. Yes.
And I think here even a psychologist would work.
Yes, it's a multidisciplinary treatment,
yeah.
definitely. It's counseling we do for our
You have
patients.
to.
And why the problem is that they may ask the counselor, what's my cure rate? Then they are against it. So that's why we have to do the job. So basically doctors have to counsel the patient about the treatment, because they are worried about the cure and treatment part. So it's our job, and definitely we refer them to a psychologist if they require any medications and any counseling. We refer them to a psychologist also. So that facilities are there in most of the cancer centers now.
Okay, and I wanted to also touch on this point, if the cancer treatment, because whenever you hear about cancer, the next thing that comes to a person's mind is, oh, it's going to be expensive, how do I get out of it, because I don't have the enough finance to do it. So can you just take us through the point that these days hospitals are, the government hospitals are coming forward and giving free aids to these cancer patients?
That's one thing which has happened recently. So if you go to RCC and all the pediatric patients are treated completely free.
Okay.
So that's one good thing.
The pediatrics.
All the pediatrics are given completely free treatment, and there's a subsidized treatment for other cancers also. And why, if you ask me, why the government is not able to fully support, is because in many cases it may be advanced stage where there is no cure. So how much the government will be able to support them is a very difficult question. So again, in a very advanced stage, whether to treat, what we are treating is again a very difficult question to answer. So, but it has become very cheap, means it has become affordable. The cancer drugs are available at a very affordable prices, particularly in the government hospitals and even private hospitals also. So the cost per se is not a big issue now. We can tell to the patients, and up to how much they will be able to afford, we can give them that treatment. So it doesn't matter if the very expensive medicine will give them cure, not like that. In many conditions that may not be true.
So I think even a simple medical insurance policy would help them, right? That is again one of the things.
Like any illness, insurance it's mandatory now. Yeah. I think everyone should have insurance coverage, so that when such unforeseen things happen, they will be able to get the help.
So, doctor, do you have any message for our audience?
Yeah, definitely. For cancer, I think the prevention should be the first thing, and for prevention, tobacco should be avoided. You should not smoke, you should not use pan or any form of tobacco, has to be completely stopped, because if you can avoid that, then a large quantity of cancer deaths or cancers can be prevented. That's first thing. Second thing, any problem which comes, we have to consult a physician and go for the test. You should not avoid thinking that the fear of cancer should not be there, because only if we are able to diagnose at an early stage, we will be able to cure the disease. And even when it's an advanced stage, still we may be able to offer them good quality of life. We can reduce the symptoms, and there are treatments which are affordable and which will definitely improve their quality of life. So there are options are there.
Dr. Arun, thank you so much for coming to the show and sharing the valuable information with us about the most dreadful disease, that is cancer. And you all have to stay healthy, because you have to lead a very happy life, you and your family. Now, till next time we come back to you with more information regarding more diseases. Till then, you can always be in touch with us on youthdairy@gmail.com. Till then, bye-bye.